There are a lot of things we are not aware of, but that doesn't mean they don't exist. Well, at least that's my belief. You can expect some kind of information like that from this video. There are a lot of strong people in this world facing health issues, not physically but mentally. There are a lot of diseases and disorders we normally talk or hear about, but there are also some that are so rare that very less people know. And in this video, we will be discussing a lot of them. Morgellons disease, also known as MD, is the first one on our list. People with this rare disease are well aware of the pain they have to face and the crawling, biting, and stinging sensation on and in their skin. These symptoms can be very painful. More than 14,000 families who have SDC have a higher chance of catching this disease. Studies show that people with Lyme disease or bitten by a tick are at higher risk for Morgellons. In some studies, it shows that the whole disease was spread by ticks. This is not only a painful disease, but is also a very weird one. How, you ask? Well, people with this disease have reported that multicolored fiber strings appear from under their skin and come through their mouth. Scientists and doctors haven't been able to figure out what those fiber strings are made of. Symptoms are very common, which makes it harder to notice that you had this disease. The symptoms are fatigue, itching, joint aches, and pains, loss of short-term memory, difficulty concentrating, and depression. The right medical treatment is not clear, but some doctors may treat you with several antibiotics for a long time. This kills the bacteria and heals the skin. The next one on our list is progeria. This disease is very difficult to understand, but this genetic condition makes a child's body to age fast. Most kids have progeria do not live past age 13. Progeria builds up in many cells of kids with progeria, causing them to age faster. Progerin is a protein that causes cells to break down more easily. Most kids with this disease look healthy and normal when they are born, but the signs start showing slowly in the first year, meaning they won't grow as easily and won't gain weight easily. Kids with this disease develop a bigger head, large eyes, smaller lower jaw, a thin nose with a beaked tip, ears that stick out. You can see slow and abnormal tooth growth as a high-pitched voice, of fat and muscle, hair loss including eyebrows and eyelashes. These type of kids are very delicate. They could die easily from heart attack and strokes. These kids can't live a normal life. They can't do anything like play sports or run or play other things as normal kids. On number 3, we have the foreign accent syndrome, also known as FAS, which is a sudden change of accent. FAS is the most commonly caused by damage in the brain, caused by a stroke or traumatic brain injury and other causes. Speech may be altered by timing and tongue placement, so that is perceived as sounding foreign. Sometimes it's also hard to speak, and people may stutter in the beginning. CoRoO is next on this list. This is a fetal nervous system disorder. It occurred during the 1950s and 1960s. Among the 4 people in highlands of New Guinea, the 4 people contracted this disease by performing cannibalism on corpse. So you could say that this disorder is the reason why cannibalism even exists. The name CoRoO means to shiver or trembling in fear. The symptoms are muscle twitching and loss of coordination. CoRoO belongs to a class of diseases called TSEs, also called as prions. Diseases prions are abnormal proteins, also known as prions called CoRoO. There is no successful treatment for this disorder. Next up is Stone Man disorder. Even the name is horrifying. This is a disorder in which muscle tissues and connective tissues such as tendons and ligaments are replaced by bones, which is highly noticeable by the bones outside of the skeleton that affects movement. This process becomes very noticeable in childhood, starting with the neck and shoulders going down to the body and the limbs. People with this disorder may have difficulty speaking and have eating problems. Breathing problems are also very severe. This is because extra bones develop around your rib cage. People with this disorder can easily develop muscle swelling and inflammation. People with this disorder are naturally born with big toes.